Good afternoon. My name is Dr. Lauren Bennett, and I'm a clinical neuropsychologist here at the Pickup Family Neurosciences Institute at Hoag. Thanks for joining us this afternoon as we discuss depression, anxiety, and dementia. So what I want to begin by saying is that some fluctuation in mood is a typical part of life. As many of us have experienced, there's been a particularly stressful period over the past year or so of our lives, and it's very normal to expect that there will be shifts in our day-to-day feelings or nervousness in response to those life stressors. What I do want to highlight, though, is that depression and anxiety, as clinically diagnosed, are not a normal part of the aging process in particular. So of course we have normal responses to these day-to-day stressors, but we wouldn't expect someone to meet the diagnostic criteria for depression or anxiety, which we'll discuss and talk through today. We wouldn't expect them to meet that naturally as part of the aging process or for an extended period of time, even in the midst of some of these life stressors. Let's begin by discussing the diagnostic criteria of anxiety. So many of these symptoms will sound familiar. When we think about anxiety, we think about excessive worry. So as we mentioned, it's been a tough period for many folks over the past year. And it's very common to experience some concerns about your own health, the health of your loved ones, the safety of everyone around you. But when we get concerned is when that safety worry or that concern or anxiety might exceed what's typical, meaning it's all-consuming or intruding into your day-to-day thinking or day-to-day activities. You're finding that it might be hard to concentrate on anything else without having concerns about the pandemic or your health. That's when we want to get concerned and start to have conversations about whether it might be helpful to have support or assistance. We also think about restlessness. So you might experience that it's difficult for you to sit still for very long, that your mind and your physical body start moving, that you can't really stay concentrated on any activity or in the same space for much time. You might also notice, again, along those same lines, impaired concentration. So difficulty focusing or attending to a task that you're working on, engaging in a work project, or say getting the tax materials together might be difficult to remember where you are in the process or return to the task after an interruption. You might also notice increased fatigue. So as with any emotional experience, you know that sense after an emotional day when you feel truly fatigued inside and out, meaning both physically and mentally. Well, when we have symptoms of anxiety that are chronic or ongoing, we often experience that fatigue on an ongoing basis, meaning days of having that kind of heightened level of awareness or arousal in our physical body can then lead to an emotional and physical fatigue. You might also notice difficulty sleeping. So it might look like difficulty falling asleep, might look like difficulty staying asleep, or both, right? So you might find that your mind starts to wander or worry while you're trying to fall asleep or fall back to sleep. Your loved ones might notice that you're more irritable. Perhaps you're shorter tempered or have a shorter fuse, more quick to get upset about something, an incident that may not have set you off in the same way, say, prior to all of this anxiety. You may also notice soreness or muscle aches, a physical manifestation of carrying that stress day to day. What I want to highlight here is that you're not alone. As mentioned, many folks are experiencing increased symptoms of depression or anxiety, irritability, or sleeplessness. And those changes in sleep and eating and activity patterns on your day-to-day functioning are common and normal, particularly when responding to a stressful period like our pandemic, for example. And anxiety often serves a function, right? So anxiety from an evolutionary perspective has served to protect us, right? It gives us a heightened arousal to make sure that we and our loved ones are safe. It can be motivating, say the anxiety you might experience the night before a big exam or test back in grade school. And it also can help us to inform our decision making, right? Give us a clear sense of how we're feeling about something, when a decision might be right, when it might be more comfortable for us. But as mentioned, there are these life stressors at the current time that go above and beyond, and the issue that we're seeing in many folks is this continual, ongoing sense of anxiety. And I want to spend a bit of time talking about anxiety as it relates to the COVID-19 and the recent current socio-political climate. So first off, a concern we're hearing from many folks, I'm sure this will feel familiar to you, is I'm scared I'll get sick, right? And so across the past year, we've had those heightened concerns or even longer. And the challenge is that those have been ongoing, day in, day out. And many folks are carrying that physically, emotionally, in a way that they haven't experienced previously in terms of the long-term impact of that level of stress or concern. Similarly, folks are feeling like they're failing at doing it all. So many folks have taken on more responsibility during the pandemic. A lot of our students are learning from home still, so they're trying to manage a role as teacher, a role as a worker in their employment role, and then also try to keep up with the household and the increased demands across all of the various hats and occupational expectations that they're carrying. A lot of folks are experiencing some impact to their sleep throughout this period as well. So there's been a significant shift in routine. Many folks are finding that they're actually working longer hours, is what the research tells us, because there's less separation between work and home. And so it's tough to turn your mind off at the end of the day. It's harder to see that separation between where work ends and when home life begins, while trying to keep up with all the various responsibilities. And many folks are also noting that they haven't been exercising or perhaps optimizing their diet in the way they might hope, which actually makes their physical and emotional functioning worse. They're feeling more severe or more significant symptoms of depression and anxiety because they're not able to keep up that solid routine, not exercising, not eating right, and of course that's having a physical burden and a physical negative impact in terms of how they're doing with their routine. And another common concern that I'm hearing is that folks feel like they'll never adjust to what we consider the new normal, right? So we've all experienced changes in our functioning day to day over the past year. And as we settle into this kind of new pace of life, and now we're readjusting, of course, to reopening in some areas or having shifts with the vaccine rollout, but there's been challenges in terms of really acclimating to this new normal and getting used to the pace and the changes in routine overall. Let's talk next about depression and symptoms we commonly associate with depression. So as is commonly associated with depression, we think about persistent, sad, anxious, or empty mood. So something I want to highlight here is that symptoms of anxiety can, of course, be related to depression. They can also exist outside of or beyond the anxiety issue or realm. So they can be part of the same depressive episode, or they can be in addition to, in excess of, and in collaboration with a depressive symptom. We also note symptoms of guilt and hopelessness, so feeling like you may not have a way out, feeling a sense of despair in terms of your current position in life, without a hopefulness that there will be improvements in the time to come. We also note that folks might experience a decrease in their interest or energy, so you may find that you're not as interested in hobbies or activities. Some social withdrawal might also come along with that, so less interested in connecting with loved ones, community members, church groups you may have previously been involved with. As noted, depression symptoms can also impact your sleep cycle, much in the same way of anxiety, by causing rumination, difficulty with sleep onset, and sleep maintenance, which means difficulty staying asleep throughout the night. There can also be an impact on your concentration and your attention while focusing on tasks. We can also see a shift in terms of eating a lot less or a lot more, changes in appetite broadly. We can also see folks having changes in their pace in terms of how quickly they're moving, how quickly they're thinking. So you can actually see that folks look more slowed down, almost like they're operating in slow motion or underwater. And then of course, if you're having any symptoms or thoughts in terms of wanting to think about harming yourself, taking your own life, or even more passive thoughts of suicide in terms of thinking it would be better off if I didn't wake up tomorrow, or my family would be better off without me. All of these are symptoms that are concerning for depression. Depression can look a little different in our older adult population. So we often see that there's more physical presentation in terms of the symptoms of depression in our older adults. So we'll see more of a fatigue, more tiredness, more physical symptoms or concerns. Changes in mood, of course, are still common, but it might look more like agitation or irritability versus some of the depressive symptoms that we commonly think of. There also can be more confusion, so difficulty orienting to time and situation, place, keeping up with what's going on in current events. That same difficulty with attention can present, but it can also present as difficulty with decision making or feeling like an inactivity in terms of wanting not to make decisions or move forward with different choices. Depression can also present or masquerade as memory difficulties in our older adult population. So more difficulty, increased difficulty recalling recent events or conversations, and it can sometimes be challenging to tease apart what might be due to depression and what might be an organic emerging memory difficulty. And then, as we mentioned, there's also this heightened physical concerns or complaints. So we often hear that folks might experience more headaches or those sleep disturbances that we mentioned. Physical joint pain can also come along with that. There are risk factors for both depression and anxiety that I want to mention here. So our genetics are one risk factor. So having a family history of anyone who's experienced mood symptoms broadly, depression or anxiety, or even a post-traumatic stress disorder previously. And our same factors in terms of our genetic can also impact how we respond to the medications we commonly use to treat both depression and anxiety. So our responses to medications and other interventions like talk therapy may also be impacted by our genetic predisposition or our genetic response to some of those medications and interventions. One's personal history also plays a role. So the psychosocial stressors that you may have experienced across your life, the stress you might be undergoing not only at that moment, but in terms of your history, exposure to trauma during childhood or while growing up, all of those factors play a role in your likelihood of developing symptoms of depression or anxiety throughout the course of your life, as do lifestyle factors. So we've seen from our research that sleep, diet, and exercise actually lower our chances of developing depression or anxiety and can help manage those symptoms in the moment, which we'll talk more about here. There are some additional risk factors that are quite prevalent in our older adult community that I want to touch on. So of course, older adults are more likely to have chronic health conditions, things like chronic pain disorders, challenges with chronic health conditions, medication and side effects from medications can also play a role in one's risk to developing both depression and anxiety symptoms. Of course, in our older adult population, there's also higher likelihood that you may have experienced a recent loss, and you might be experiencing grief or bereavement that can complicate or make challenge in terms of both the depressive symptoms and the anxious symptoms. Obviously, what might start as a response to a natural loss, like a grieving process or bereavement process, then might extend longer, well beyond the loss of that individual, into a more chronic mood condition. There also, of course, can be loss of independence. So in our older adult community, we often see things like walking away from driving or perhaps making a move into a more supportive living environment, like a retirement community or perhaps an assisted living facility. Oftentimes, with some of those changes in our physical needs, we see that our older adults have some changes in their mood functioning in response to the loss of independence, even when it's a agreed upon or widely supported move. It can be challenging to go through those transitions and to keep up in terms of the buoyancy of one's mood during those events. Often, of course, retirement comes with a loss of sense of purpose. So for many of us, our work is a key cornerstone in our identity. Same thing can be true for raising a family. And as that family or that work role is no longer a part of our life or a key part of our life, we can see a huge loss of sense of purpose that can have a dynamic impact in terms of our mood functioning, as well as just our overall sense of well-being. And then, of course, we also see that depression is common in some other illnesses. So when we think about diabetes, cancer, heart disease, the neurodegenerative conditions like Alzheimer's or vascular dementia or Parkinson's disease, oftentimes we'll see that mood symptoms are really commonly comorbid, meaning occurring at the same time as the chronic health conditions, or in the case of neurodegenerative diseases, the mood symptoms, the depression, the anxiety, can actually predate the cognitive changes by somewhere between 3 and 5 years commonly. I also want to highlight that there's an overlap here between symptoms of depression, anxiety, and what we think of in terms of dementia. So if you've been able to join for any of our other talks, just a brief reminder that dementia is what we think of in terms of impairment on objective neurocognitive testing, as well as an impact in day-to-day functional independence, so challenges with managing finances, medications, and schedule independently. So when we think about depression, anxiety, and dementia, there are some symptoms of mood challenges that can look quite a bit like a dementia. We refer to these as pseudo-dementias because they often can masquerade and make it difficult to tease apart what might be due to mood factors and what might be due, as we said, to a neurocognitive disorder that might be emerging. So there's a behavioral overlap in terms of what you might see, both in mood symptoms and cognitive symptoms. The behavioral piece often looks like a loss of interest or hobbies, more social withdrawal or pulling back, not being as engaged during conversations, a desire to isolate more, be alone more, and also apathy or being less motivated to go out to run errands, to engage in prior hobbies as mentioned, or just get up and get that to-do list done. There then is also the cognitive impact or overlay between the anxiety and the depression that can also look similar to dementia-type symptoms. So again, difficulty with attention or concentration, memory concerns, so increased difficulty recalling recent conversations or events, slowed processing speed, so needing more time to process information, make use of that information in a meaningful way. Difficulties, as we touched on, in terms of decision-making, also planning and organization. So you might find it's more difficult for you to coordinate a meal, get all of the items onto the table hot at the same time, or plan an upcoming vacation. More challenging to book the flights, get the excursions planned, pick out a hotel, coordinate all the aspects of the trip. We can also see a decrease in self-esteem, meaning that someone may not feel as confident or as comfortable speaking up in a group conversation or expressing their thoughts because of language changes they're having, and that can also negatively impact cognitive performance. I want to highlight here that the prevalence of depression and anxiety in older adults is quite high, right? So 1 in 4 older adults, meaning our 65 plus community, experiences symptoms of depression and or anxiety at some point during their older adulthood. So it's quite common. Just because it's common, though, doesn't mean we should expect it to be a normal part of life. What I mean by that is it's important to take steps to minimize the impact of anxiety and depression. What we know from the research is individuals who experience symptoms of depression and anxiety who do not manage them in their adulthood, their general adulthood, are actually at an increased risk for developing a neurocognitive disorder later in life. So symptoms of anxiety and depression that go unchecked actually contribute to our risk of developing a dementia process later on. So we want to be really proactive. And if you're experiencing those symptoms later in life, the same is true. Those symptoms of depression and anxiety can exacerbate, worsen, magnify an emerging dementia process. So again, we want to be quite proactive and take a really aggressive approach to treating those symptoms to minimize their impact on our cognitive functioning. So when should we be concerned? Well, it might be helpful to seek additional support, which is a great starting point in terms of reaching out to your primary care provider or a neurologist if you're already working with one. And these are the types of situations when I would want you to get concerned and want you to have those conversations. So if you're noting persistent symptoms of depression or anxiety, meaning that you're feeling like they're impacting you day to day, impacting your social relationships, perhaps your work or volunteer roles, your family engagement, if you're noticing overall that you see an impact in your thinking and memory from depression or anxiety, we absolutely want you to initiate a conversation with one of your treating providers. If you feel worried or concerned, or perhaps a loved one has highlighted that they've noticed changes in your behavioral functioning or mood functioning, that would also be a time to express those concerns and share them with a primary care provider or another treating provider to get the ball rolling in terms of a thorough evaluation. Similarly, if you've noticed any challenges in terms of your sleep patterns or your day-to-day routine, that would also be a nice point at which to begin a conversation with your treating providers. A few treatment considerations that I'd like to touch on. So it can be very helpful to start by talking to your primary care provider. If you already are working with a neurologist or a psychiatrist or any other specialist who might be able to specifically speak to the memory, mind functioning aspect of it, that can also be a wonderful entry point in terms of initiating a conversation. There are certain medications and some medical conditions that have a higher or increased risk of causing symptoms of depression or anxiety. So the first step might be having a conversation with the treating provider to determine if you're on any of those medications where it might be expected to have a mood impact. Might be appropriate then to adjust your dosage or switch to another medication if you are having any of those side effects. And a medical doctor can also rule out the possibilities of any impact of those medications by doing things like a physical exam, an interview, and any necessary or relevant lab test as well. Right? If your doctor doesn't find any medical reason that might be causing some of these mood symptoms, the next step would be for you to initiate a psychological evaluation. Generally, that's done with a therapist or a psychologist or a psychiatrist. So depending on the level of care that your doctor thinks might be appropriate, they'll likely make an appropriate referral then to a provider that can help with those needs. And the most common treatment, if you're identified to have either a depressive or anxious symptom or disorder, then it would look like psychotherapy or perhaps medication intervention or both. Let's talk through first therapy of options that are available for depression and anxiety. So this is what we think of as talk therapy or psychotherapy. And generally, the interventions that we use for anxiety and depression are relatively brief. So many people think about lying on a couch, talking about their childhood. And that's not usually the interventions that many psychotherapists use these days. We actually do really targeted brief interventions that are often starting around 3 to 5 sessions, up to more commonly around 10 to 20 weeks, depending on the issue and the impact of that issue. Most commonly, we use something called cognitive behavioral therapy. And this looks like challenging negative thought processes and how they impact your behavior that might be causing a cycle that has a negative impact on your day-to-day well-being. So looking at the thought processes that you're having as well as the behavioral impact of those thought processes and challenging both the thought processes and intervening with the behavioral cycles to make a more positive impact on your overall sense of well-being. We often, in conjunction with cognitive behavioral therapy, will use something called interpersonal therapy. And that's particularly effective if there might be some sort of relationship issue that may be contributing to the depression or magnifying the depressive symptoms. That can also be a helpful starting point for dealing with those types of issues. Medications for anxiety and depression are most commonly used medication is antidepressant, is the classification of medications. There are many different types of antidepressant medications. And as I mentioned, your response to those various medications depends entirely on your particular brain chemistry. So if working with a provider, they may ask you if there's been any other family members that have had any kind of mood challenges in the past, and if so, what medications they responded to well, since that can be a helpful starting point. There are many different chemical approaches to helping balance the neurotransmitters or chemicals in our brain that cause the symptoms of depression and anxiety when they're imbalanced. So the challenge here is finding the right one to respond to your particular brain chemistry and needs. And so working with a provider to go through the most commonly appropriate medications, and then of course ruling out any side effects and making sure that's a good fit for you, that's the best approach. I always encourage folks that you may need to try more than one medication. So if the first medication you try does not seem like a good fit, have faith. We've got lots of different options. It's important to talk to your provider to see if there might be a better fit. Just like a good pair of shoes, even if I love the pair of shoes and they're my favorite pair of shoes, they may not work for you, they may not fit your feet right, and they may not be for you. That's okay. Keep trying, right? We'll find one that's a good fit for you. I also want to mention that it often takes up to 8 weeks to see the full impact of antidepressant medications in terms of the mood benefits. The challenge with that is that we often see the side effects first. So side effects often present around the 3-week mark. Folks can get discouraged by having some of the generally pretty subtle, but perhaps like a GI-related side effect without yet seeing any benefit from the medication. So just know that the side effects will come first. If you're experiencing side effects, do talk to your prescribing provider. And then, of course, hold on if you're able to, or if you need to, switch to a new medication, and know that the mood benefits or impact will come around the 8-week mark. I also want to mention that it's very important if you're ever prescribed an antidepressant medication to not stop or discontinue the medication without talking to your doctor first, right? These medications can have a negative impact if they're stopped too suddenly. Just like it takes time for them to build up in your system, it also takes time to appropriately titrate down or off of the medication. So be sure and talk to your prescribing provider to initiate that titration process and decide if and when it might be appropriate for you to come off the medication. The challenge we'll often see is that folks feel much better, usually around 6 to 12 months on the medication. They might decide they don't need that antidepressant anymore and decide to go off of it themselves, but there can be a negative rebound effect. And so it's important to work with your prescribing provider to get off that medication gradually, and we see less impact in terms of the negative rebound if you're able to do that. Okay? And stopping an antidepressant medication abruptly can cause withdrawal symptoms physically as well. So you want to make sure you're doing that under the appropriate medical supervision. If you're having any side effects, as mentioned, please be vocal with your prescribing provider about them. There's lots of other options in terms of medications that are available. We also want to make sure that you're mentioning all of your prescribed medications and any supplements you might be taking to the prescribing provider when considering an antidepressant medication, because there can be adverse interactions between various medications and supplements as well. So for example, a commonly used herbal medicine is St. John's wort, and it can have a negative impact with antidepressants. So you want to be sure and disclose all of the medications and all of the supplements you're taking so your prescribing provider can make an appropriate choice about which medication might be correct for you. We also have some wonderful lifestyle tools available to us. We've touched on some of these, but let's talk through them a bit more here. So we know from our research how essential good quality and good quantity sleep is in terms of our mood functioning and then our risk of all kinds of chronic health conditions. So good quality sleep across your lifetime lowers your risk for cancer, neurodegenerative disease, and mood disorders as well. Making sure that you're managing your exercise and being proactive about exercising. The goal, of course, is working out for around 150 minutes a week of cardiovascular exercise. So many people do that, looks like 30 minutes 5 times a week. Making sure that you're being proactive about a good diet. And there's lots of resources here on our Hoag YouTube channel if you're interested in learning more about that. We know, of course, that social connection is also essential in supporting our mood functioning and our cognitive health as well. And then making sure that you're engaged in purposeful activities. As mentioned, that can often be challenging as we slow down towards the later phases of our life. So finding really rewarding ways to stay engaged, whether that be spending time with your family, your grandchildren, helping with homework or science projects, volunteering, which there's many options to do from home as well right now. So getting creative about what your day looks like and how you're filling your time. And then, of course, if you are experiencing any symptoms of anxiety or depression, be proactive and be sure and mention them to your provider as early as possible. We know from the research, of course, we've got the greatest impact or the greatest ability to intervene the earlier we get started on our talk therapy or our medication interventions. All right, and I wanted to mention a few resources here, and then we'll take some questions. So first up, we have the NAMI Worm Line. You can see the phone number on the screen here. This is a wonderful non-crisis support line for both mental health and/or substance abuse issues. There's also a live chat available at namioc.org. I've also listed the phone number for the Substance Abuse and Mental Health Services Administration, which is a national organization, what's called the SAMHSA Disaster Helpline. So if you're experiencing any kind of emotional crisis, that's also a wonderful starting point. There is a great agency here in Orange County that's based just on Orange County resources for mental health. So I've included the phone number to call there if you're interested in getting more information about available resources in our community. And if you're having any suicidal thoughts, I've encouraged you to call as soon as possible the National Suicide Prevention Lifeline. Phone number is listed on the screen, or there's also a text option if that might be your preference. Then finally, I've listed the the websites rather, for both AA and NA if anyone might be experiencing any distress related to substance abuse. I've also included the phone number here for intimate partner violence if that might be something you're struggling with at this point in time. And finally, a general link for community-based resources specific to COVID or other financial concerns related to the pandemic that NAMI-OC has set up as well. All right. And if you're experiencing any changes in your memory or mood functioning that you think might exceed normal aging, and you're looking to follow up first with your primary care provider if that might be appropriate, we also have a program here at Hoag called the Orange County Vital Brain Program. I've listed the phone number here on our screen. That serves as a brief cognitive screener that can help triage you to any necessary resources, whether that be a neurology consult or sleep medicine consult or community-based resources in terms of mood functioning. So if you'd like to get a screening of your memory functioning and a check-in in terms of your subjective cognitive concerns, that's a great starting point here at Hoag. All right, let's take a few questions in the time we have left. So this question says, if taking medications for anxiety, what should I do if I miss a dose of medication? So without knowing the specifics of what medications you're taking, I'll encourage you to talk to your provider. Generally, if you're within 90 minutes of the dose, the recommendation is to take the medication as prescribed and then go about your regular schedule. But if it's more than 90 minutes, usually the recommendation is to wait for the next dose of the medication. But I'll defer you to your medical provider just to make sure that's the appropriate recommendation for your specific medication. Can anxiety be misdiagnosed as depression? Absolutely. As you saw in our time together today, there's a lot of overlap between the two conditions. They look very similar, right? They often go hand in hand. So it is possible to misdiagnose anxiety as depression or vice versa. If you have any concerns, please do speak up to your provider, vocalize those concerns, and feel free to get additional resources or support if you feel like a different diagnosis might be more appropriate or more helpful. Is there any chance I can pass anxiety on to my kids? Yes. So there we are at a higher genetic likelihood. So if you yourself are prone to anxiety and depression, there is an increased likelihood that your children would as well have that same genetic predisposition for those kinds of conditions. But it's not always certain, right? So fortunately, there's one other person whose genetics got mixed in there. We also know, for example, that oftentimes different life stressors or early events can help lower or raise our threshold in terms of what's taken in terms of our risk of depression or anxiety. So it might also have some other factors involved. But yes, certainly there can be a genetic component. We often see that in families. And the last question I got here is, can I discuss natural vitamins that can be used to treat anxieties versus SSRIs? So what I will say is that we don't have any supplements at this point in time that are approved for the management of depression or anxiety. And I would encourage you to talk to your primary care provider or any psychiatrist or neurologist you might be working with about an SSRI. There can be some supplements that are useful in terms of conjunction with an SSRI or a serotonin selective reuptake inhibitor. But with that in mind, do talk to your prescribing provider to make sure that those would be complementary medications. There wouldn't be any adverse interaction between the two medications. All right. Well, thanks so much for joining us today. I so appreciate your time. I hope you all are doing well and will continue to be well. Thanks for joining us.